and a number of persons have gotten their vaccine, including public health nurses, President of the Nurse Association, former Prime Ministers Golding and Patrice, and many others. It has gone smoothly so far.
Get vaccinated as soon as you get all the facts, don't listen to the rumors.
I'm encouraging all Jamaicans, healthcare workers, frontline workers, elderly, all persons with comorbidities who are going to be offered the vaccine. I know that there is apprehension out there. I know that persons are afraid. Some persons will tell you don't go. They say I'm not going to go. But I am encouraging you, not just as a healthcare worker, but as a regular Jamaican, protect yourself from
Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Dr. Melody Ennis, Director of Family Health Services in the Ministry of Health and Wellness, Mrs. Helene Davis Whyte, President of the Jamaica Confederation of Trade Unions, St. Patrice Ennis, Vice President of the JCTU and the General Secretary of the Union of Technical, Administrative and Supervisory Personnel, Mr. Clifton Grant, Assistant General Secretary of the JCTU and Vice President of the University and Allied Workers Union, Mr. Kavan Gayle, President General of the Bustamante Industrial Trade Union and Executive Member of the JCTU, members of the media, ladies and gentlemen, good morning. Thank you so much for joining us for this special press conference as we look at our COVID-19 Vaccination Implementation Program with a special focus on our trade union partners. We'll begin this press conference with the remarks from the Honorable Minister.
Thank you very much, Stephen, and please allow me to remove my mask. Can't speak clearly without it, but I'm vaccinated fully. Mrs. Helene Davis Whyte, President of the Jamaica Confederation of Trade Union and General Secretary of the Jamaica Association of Local Government Officers, St. Patrice Ennis, Vice President JCTU and General Secretary of UTASP, Mr. Grant, Clifton Grant, Assistant General Secretary of the JCTU and Vice President of the University and Allied Workers Union, Kavan Gayle, President General of the Bustamante Industrial Trade Union, Dr. Ennis from my shop, Ministry of Health and Wellness, distinguished ladies and gentlemen, one and all. I really want to just welcome all who are here, our special guests from the organized labor movement. This is an important occasion, and I want to begin by thanking them for agreeing to participate in this public show of support for the COVID-19 response, a very clear and present danger to our population, to Jamaicans, and certainly to the working class movement who they provide leadership for. I know that Mr. Granville, Valentine, should have been here, but he called late to say he was indisposed, and so we wish him all the best. Some time ago, we had a meeting before now, myself and a number of the trade union leaders, including those persons present here, and we had a discussion around the approach to the COVID response. And there is absolutely no doubt that there is full agreement by all that we have to move as one, as a country. No matter which interest we represent, we are a mix of stakeholders forming an economy, a society, and we rise or we fall together when we have threats of this kind, in this case, a serious public health threat, a global pandemic, and certainly a national challenge. The evidence of this threat are apparent and have begun to take its toll on all of us as citizens, and the likes of which I think we haven't seen in over 100 years, this type of public health threat. Indeed, from a disposable personal wealth and income perspective, we have seen a drop in GDP, which means economic activity, which clearly has implications not just for employers but for employees. We have seen over 100,000 job losses. And from a public health standpoint, many persons grappling with mental health issues from restrictions, them being deprived their opportunity, their freedom to move about, to seek their best endeavors and interests in their own way. So COVID-19 has had a debilitating impact on our population and on our working class. We have seen our health system challenged to provide protection for the population, and we continue to experience these challenges on a daily basis. We have seen recently, as early as last evening, the announcement of a new variant strain, MU, which is now present in Jamaica, confirmed by tests. And we have been battling with the dominant strain over the last number of weeks, which is the Delta strain. And all combined have created somewhat of a perfect storm in terms of the third wave that we are now experiencing. Not unique to Jamaica, but it comes with it the big challenges for us. We have seen over 75,000 cases and counting based on tests done, and tragically we have seen over 1,800 deaths to date. As expected, with the increase in the cases, bed occupancy levels would increase, and now as bed occupancy is classified as being under extreme high pressure. We have seen most of our hospitals being challenged, and the real issue with this threat is to avoid being overwhelmed as a public health system, and we have come very close to that, and attribute, of course, to our medical staff who have done their best to manage the challenges that we have had to encounter. The real issue and the purpose for a meeting of this kind is to identify with the risk and the challenges that we face as a critical challenge that requires a unified response. And in so doing, more specifically, to find the most effective response to overcoming the threat of COVID-19. And while we have done well and will have to continue the non-clinical measures, the mask wearing, the physical distancing, the sanitizing, in a sense, life has been changed significantly because of those rigid requirements and the restrictions on movement in some instances. The most effective response to COVID-19, as attested globally, has to be vaccination. We have to get our population vaccinated. And up to this point, the challenge has been getting vaccines while using non-clinical measures to manage the spread of the virus, not to overwhelm the system. Today, we have vaccines. We have seen the month of August being the most significant month in terms of vaccine acquisition. Over 800,000 doses came in that month of August. Over 1.1 million vaccines to date, and counting. We expect vaccines next week, and we will see vaccines coming in every few weeks or at least every month going into the new year. So we no longer have that issue. In addition to that, this gathering will reaffirm the efficacy, the safety of the vaccines that we have acquired and are making available to the population. We have never thought about bringing in vaccines that are not approved that have not gone through clinical trials, that have not been examined, the data, by the experts at the highest level, the World Health Organization, and therefore given the seal of approval as being safe for our people to take. And indeed, the strength of our immunization program over many, many decades, which has contributed to our Human Development Index, life expectancy being where it is, fighting against things like, polio and other such diseases, has been in the foundation of our approach to vaccination, if you look at our history. And we have kept that standard as it relates to the COVID-19 vaccine. And that's something we want to reassure the country about and persons who may have concerns or questions. And then thirdly, the myths, the perceptions around alternative or ulterior motives or conspiracy theories around the vaccines that, is out there in the free media space. It is the Antichrist, or it has a chip, or it is about tracking people, or all of those things that have been said. I think it's important for us to break down those barriers and appeal to those we provide leadership to, because, again, the vaccines represent the most significant response to our country, our people, and to getting us back to normal. So today's gathering is really to allow my colleagues in the trade union movement to voice their position, their opinions, their advice to those they provide leadership for and the country generally, and essentially to provide that platform to show to the country that we are one in terms of the approach to getting our country back to normal, using vaccination as an important tool, and to give that support, which hopefully will influence take-up as we embark on what is the largest mobilization program around a critical health threat that this country has seen perhaps in our lifetime. So thank you again for coming. I'll stop there until there may be other questions, and I will now move to, where do we start, Madam? Okay, so you just use your mic, and let me put this here. That's not needed. Well, she's close enough, so.
Good morning, everyone. Minister Tufton, Dr. Ennis, my colleague, trade union leaders. As Minister indicated, we are here this morning as trade union leaders because we feel that we have a voice that needs to be heard on this whole issue of vaccinations in Jamaica. The JCTU has noted with concern the increasing number of deaths and hospitalizations arising from what has been termed the third wave of the COVID-19 pandemic in Jamaica. We also note the deleterious effect on workers due to unemployment and underemployment brought about by business closures, curfews, and lockdowns. We accept that vaccines are an important part of the measures to contain the spread of the virus and to limit hospitalizations. places of work. A feature of this initiative will be information sharing sessions where workers' questions may be answered and concerns and fears allayed, and importantly, where myths may be debunked. We wish to also make it clear that the JCTU does not support mandatory vaccinations at this time and is concerned about the apparent trend towards mandatory vaccination by some employers. We wish to also commend the efforts of the social partners that has led to the development of a protocol advisory on COVID-19 measures. We wish to encourage the promotion of treatment modalities that, when supervised by qualified, competent medical professionals, can also help to reduce hospitalizations. Finally, the JCTU calls on all well-thinking Jamaicans to play their part in the country's achieving the target of approximately 70% of the population being vaccinated by March 2022. We believe that this is essential to us being able to return to some kind of normality, because we recognize that it is not going to be a quick fix, it's not a panacea, but at the end of the day, the vaccines will be able to allow us to come back to some kind of normality where we are able to meet each other and to socialize and to be back in our workspaces in a comfortable kind of way. And so we want to call on Jamaicans in all walks of life to do their part in ensuring that we can bring Jamaica back to the place that we would want it to be. And so we have therefore, as we said earlier, partnered with the Ministry of Health to take the vaccines to workers in their workplaces where it will be more accessible to them. I will now turn over to my colleagues to make any kind of statements they may want to make in regard to the issue.
Good morning. St. Patrice, Ennis, Vice President of the Jamaica Confederation of Trade Unions. Our presence here is an affirmation of our support for the Ministry of Health and Wellness, and in trade union parlance, we want to say we are in solidarity with the Ministry of Health and Wellness and the government in their efforts to have the country vaccinated 80% by next year, because in our business, we have noticed the impact, the adverse impact it is having on our labor force. As the minister mentioned, tens of thousands of workers are out of work. We have seen a significant drop in our GDP. Productivity is down. Companies at this moment are really reeling from the effect of absenteeism caused by the COVID virus and its resultant illnesses. So it is imperative for us to get on board. As the minister alluded, this is not the time for us to be divisive. And this is why, in clear and unequivocal terms, we are here to make it abundantly clear that we support the effort for vaccination, and we have started at our various work sites to encourage our workers, as the minister would have known. Individual companies have used their site as a place for vaccination. Many workers have taken up that, and trade unionists all over have been instrumental in having that take place. So that's it for now.
Good morning. Clifton Grant, Vice President of University and Allied Workers Union, Assistant General Secretary of the Confederation of Trade Union. This initiative is a continuation of what we have been doing at the workplace. in order to educate the workers and to encourage workers to really get vaccinated. I am fully vaccinated, and I think that as trade union leaders, we have a duty to do everything to ensure that not only the workers in the workplace are vaccinated, but the entire society. But there are too much noise in the communication link. And I think that the conspiracy theories are drowning out the communication line. And therefore, we need to find the method of countering that. And one method of countering it is to really take the vaccine and take the professionals where the workers are. And in the workplace, the workers are much more comfortable in asking some of the questions that are bothering them from reaching to the point where they decide to take the vaccine. And therefore, we joined with the ministry, and we joined with employers to make sure that the workers who are still hesitant in taking the vaccine get answers to the questions that they are asking that are really causing them to hesitate. And we have to address some of the major problems we have in terms of information out there and behavior, because some prominent persons and professionals who we think would be at the head of the line in leading the charge for the country to be vaccinated, they are engaged in activities which is confusing the workers as to whether or not this vaccination process and the vaccines really can contribute to their protection. And therefore, as trade union leaders, we have an obligation where we see there are problems, where we see there are challenges with the workers, that we do everything to create that avenue and that forum where they are comfortable of communicating with those who have the information as to why they should take the vaccine. And so in the coming days, we are going to engage with the ministry to go into the work centers where workers indicate that they want us to come and for us. And we will also encourage workers to also give us that opportunity to bring the vaccine to them and to bring the professionals so that they can get answers to the questions that are bothering them. That is what I want to say at this point.
Good morning, everyone. My name is Kavan, Gayle, President of the Bustamante Industrial Trade Union, and also an executive member of the JCTU. I want to start, Minister, by commending you and your team and those health sector workers for the tremendous work that they have been doing and the sacrifice that they have been making through this pandemic. You know, in a time of crisis, the trade unions have always been in the forefront in participating, in working as partners. And there was absolutely no hesitation in us standing up to the call throughout this crisis. We would have met with the employer groupings. We would have met with you, Minister, and today we are demonstrating that we too believe that this fight against this pandemic is so critical. We have gone through many challenges in the workplace: loss of jobs, loss of earnings, increased stress, loss in productivity, loss in revenue for employers, and it has created the greatest level of uncertainty in the environment. And so it's important for us to work in partnership, to be collaborative in this fight against this pandemic. We have reached a very critical stage in terms of this climb and the fight against this pandemic, vaccination. We believe that vaccination is so critical not only to protect and save lives, but to get our economy back on track. And so we are fully aware of the extent of hesitancy by a percentage of the population towards vaccination. And so today, we're lending our voice for people to understand and to become aware that it is safe to take the vaccination. It is a way of protecting your life. It is a way of protecting the life of your family. It is a way of protecting the life of the workers that you sit beside, that you work with on a daily basis. And so we urge you to take the vaccine. The world has been moving ahead in terms of getting its population vaccinated. As Jamaica, we can't be left behind in this race. And you know, when it comes to racing, Jamaica is never normally left behind. And so we need to increase our momentum in getting our people vaccinated. We also believe that because of the hesitancy, there needs to be, one, accessibility, getting the vaccine to the workplace, getting the vaccine to those areas that might be difficult to get people out. We also believe that as part of the intensity and the drive to get people vaccinated, awareness, information, and education around the vaccine is critical. So we are lending support to this initiative. We will continue the blitz in our various workplaces. We will continue to have discussions with employers around the accessibility, around the information to workers as it surrounds vaccination. So I want to say to Jamaicans today, those who have not taken the vaccine, take the vaccine as quickly as possible. Thank you.
All right. Thank you very much, Minister, and thank you to our colleagues in the trade union movement. We're going to just invite our media colleagues who are in the room. If they have questions at this time, they can just acknowledge, introduce themselves, and then we can have those questions.
Morning, Alistair Dunkley from the Jamaica Observer. I just wanted to know, UCASE earlier this month said that it had received a number of complaints and that they were increasing regarding forced vaccination or persons, employers virtually mandating employees to take the vaccines and persons having lost their jobs. I wanted to find out from the JCTU, in your experience, how many complaints you have received in this respect? Or if you can't give a number, can you say whether they're significant or concerning, and from which spheres in particular? I was told that the security guard industry featured highly.
No, we can't say with certainty how many companies may have gone down that road. I know we have had information, I think, from 2 companies, our members in 2 companies so far. But we have had the information that is really going through almost the length and breadth of Jamaica of employers wanting to go that route. In fact, that's one of the reasons why the private sector leaders, along with the JCTU, actually sat and discussed this issue, because we felt that it was important for us to have some kind of guidance to employers as to how to proceed in situations where you have workers who are, one, where you have employers who believe that they should mandate the vaccine, and 2, where you have workers who are hesitant about taking the vaccines. And so we recognize that's a real issue, but what we do not want, and which is why we went the route of developing this advisory, what we do not want is for there to for there to be panic and fear, because when there's panic and fear, people react in ways that they would not normally act, and we need to ensure that at this time we are very well reasoned in our approach to containing the spread of the virus. So we believe that at this point in time, as we had said earlier, mandatory vaccination is not the way to go at this time, for sure. We have made that clear. And in our advisory that was developed, we have indicated that what needs to be done first and foremost is to engage with your workers, provide them with all the information, make sure there's accessibility and so on. And because it is our view that if you do that, you would have broken the back of the resistance to the vaccines, because there is nothing that can replace good information that can be depended on, and we believe that that is the approach to take now.
Just to say, Alicia, that, we're very cautious about mandating. And we would have seen efforts made by some employers to complement that mandate with threat. And we caution against it, against the background that the state has not mandated, and it is the state that really controls the provision of the vaccine. And so we find it very difficult where employers would be seeking to mandate when they have no control over accessibility of the vaccine. So you can't mandate and you can't provide. And so we would urge employers, there is no need at this time to be coercing your employees. Rather, it would be best to encourage and to support and to educate and to inform, rather than seeking to apply a mandate when you have no control over the provision.
All right, thank you very much. Were there any other questions? Okay.
Janelle Powell from CVM TV. So are employers operating within their rights to fire workers because of not getting vaccines? Because they might present the argument that they are operating within the best interest for the company. What do you say to that? Anyone from the JCTU?
Our view is that the legality of actually dismissing a worker for not taking the vaccine, especially in a situation where the worker's contract of employment would not have spoken to them having to take vaccines to either get the employment or to remain in employment. We think employers are walking on are batting on a very sticky wicket, in our view, in trying to whether dismiss workers or to take action against workers who have decided not to take the vaccine.
The truth is that there is a process for dismissing a worker, and that process is laid out in our Labor Relations and Industrial Disputes Act and in our Labor Relations Code. And those processes, nothing has changed where those things are concerned. Moreover, the efforts now to dismiss a worker because of not taking a vaccine invites questions about its constitutionality, and invites questions about human rights and also about our labor laws. These areas have not been, we would agree, has not really been tested in our court system, but we believe we stand on good grounds to say that to deal with the matter in that manner at this time, to dismiss a worker at this time would not be in concert with our established labor practices and norms.
All right. Thank you.
We are living in a society of law and order. We are living in a society where each citizen has a right. In the workplace, not only the management have right, workers also have right. And no one should create a situation where you're forcing somebody to put something in their body. And when we're in a crisis like this, when we're at war with this, with this virus, we have the Delta. Now, yesterday we heard a new variant appeared. We don't know which variant is going to appear tomorrow. So we need to unite around the whole question of making sure we do everything to protect ourselves and each other. But when you're in a war, you can't do things to create a next dispute or do things to create tension. And we're in a situation where we're in an environment where workers are hearing so much different things about vaccine and what it can do to you. We have to take the time out and be patient and to educate the workers to make sure that when they reach to that point of taking the vaccine, they are satisfied that they are doing the right thing. And mandating or declaring or forcing workers to take the vaccine is not the way we should operate in an environment where we have a national crisis. It's not only the management facing challenges, the workers are also facing their challenges. So, but we must work together in order to make sure that we do the things to keep ourselves together and keep an environment where we have peace and less tension. Because where there are tension, the solution is not going to be found. And I think that the fact that the trade unions and the employers are sitting down and having discussion, that's a good start. And I'm expecting that all employers respect and appreciate that where you want to get an agreement, we must communicate with each other, and we must communicate with each other honestly and create that environment that facilitates meaningful discussion.
All right, thank you very much. If there are no more questions, one more from CVM.
Janelle Powell again from CVM. So what would be the consequences of companies that follow through with these mandatory vaccinations, if any at all?
Well, one of the first consequences would be that those employers would erode the trust and confidence of their employees if they continue to push for this mandatory, leading to dismissals. And then you're going to have another situation where you're going to have numerous disputes around dismissals, filling up the Ministry of Labor and leading to other disputes at the Industrial Disputes Tribunal, which is already overburdened. And that's why we're saying that's not the way to go. We would have sat with various employer groupings. We are working out a set of protocols, a policy that is there to guide this vaccination process. Once that, and I believe it should come out very soon, once that is done, I would urge employers to follow it. We have urged our trade union colleagues that this is the way to go. And we are saying to the workers, let's work with this policy that is some sort of a guideline. And I applaud those employers who thought it fit to engage with the ministry and to have the various vaccination sites, creating that space in the workplace where vaccination can be provided. I applaud the employers who I have heard would have bust some employees to various sites to ensure that their workers are vaccinated, I applaud those employers who would have provided the level of sensitization around the need to take the vaccine and the safety of the vaccine. That, I believe, is the way to go. And that is what I would want to encourage employers to do, rather than promote this level of coercion towards the vaccination.
All right, thank you very much. And we just want to welcome Mr. Clarence Frater. He's the third vice president of the Jamaica Civil Service Association, who is joining us online. He does have something to contribute at this time.
Thank you so much. Morning, colleagues. The name is Clarence Frater, representing the president of the Jamaica Civil Service, Brother O'Neill Grant. And I just want to say that we strongly support the initiatives of the Ministry of Health and Wellness so far. And we encourage our members to participate and have and get vaccinated. We are happy at this point to join with the Ministry of Health and Wellness. However, we have already started the process of engaging the MOH to have them come into the various ministries and departments to ensure that especially public sector workers are employed, are vaccinated. And so what we are asking at this time is for the members, the workers within the public sector to see this as the way out of this pandemic and to ensure that they are vaccinated. Because while we do not support mandatory vaccination, we encourage all our members to get on board and be vaccinated. We are strongly of the view that this is the only way that we're going to be able to tame this pandemic. So we're happy for this initiative. The union movement and the government is at one where we're concerned as it relates to having the whole nation vaccinated at this time. Thank you.
Thank you very much, Mr. Frater. And there be no more questions from the media.
Can I say something?
Hello, Minister. Right.
First of all, I want to thank the representatives of the unions who have spoken and the endorsement that they have advanced for the vaccination program. I think this is evidence of the unity of purpose in terms of advancing this cause. And I know they are busy people with a lot to do, and so taking time to be here in presence in the flesh and even online is a demonstration of that commitment. So we really want to appreciate that. Now, voicing the support is one thing. The actualization of it, implementation, the efforts that we have to put out is really where the rubber hits the road and where we're going to get the maximum, hopefully, convincing and take-up. So I want to also recognize what was said around the need, that the follow-up discussions that will take place, the joint approach to efforts in the company, the firm level, to convince, to speak to workers. I know you are well organized with your representatives in your respective workspaces, and you have your membership, and they listen to your leadership, to your directive, to your advice. So that we encourage. Now, we can provide pamphlets, information, brochures, which we would like to continue a discussion around. We can even bring Dr. Ennis. We can allow some of our health officers to go in, health education officers. I'd like you to comment a little on that shortly. And then as it relates to vaccination at the level of the firm, we did discuss a union-sponsored blitz, just as you have the private sector initiative blitz. And I know we've been talking at least about one entity, and we welcome suggestions around any particular company. I know the bauxite company came up, and we're prepared to work with you on that, where you have a fairly significant unionized base, and once the ground is fertile, the pre-work is done to speak to workers, and there's an indication of interest, we will make provisions with you We now have we have a few mobile buses that can go to the locations. We can organize ourselves, put it that way. But I'd really like to see the union blitz complementing the private sector initiative blitz. So union initiative blitz as opposed to the private sector initiative blitz. And I want to pledge my support to you for that. Dr. Ennis, I don't know if you want to just add any other support that we could give.
Thank you very much, Minister. The technical arm of the Ministry of Health and Wellness stands ready to assist with public education, sensitization within the spaces once they are created. We have our officers that will come in. Our talks are not long and they're engaging. It's really not didactic. It is to get to the root cause of why persons are hesitant. So we are prepared to come in. Once the schedule is organized, we will participate. We also, outside of providing that amount of education on spot, if desired, we can have our rapid response team begin the immunization process. We know that some persons, if we give them some time, they may change their minds. But if we're there on the spot and talking and convincing them, then we can administer. So it really is for us to solidify this partnership, get the time schedule going, and engage our rapid response team to come in. Minister mentioned blitz activities. When we think of blitz, we think of a lot of persons, 1,000 and more. But you're not constrained by that. We do come into your organization. If you have 50, if you have 60, whatever the number of workers you have, once the space is there, we will do the talks and we will inoculate.
Okay, so thank you. So that's the kind of practical response that we are talking about. This is not just a talk for talking. This is, we're going to manifest this in some tangible response and outreach. And we in the ministry are anxious to see the union leadership provide that kind of leadership at the firm level. And we will give you the support, all right? So I don't know if anybody wants to close, but I'll just express my thanks. And we have some refreshments here, so we can have, sorry I can't give anybody online, but for those in the audience.
Minister, I just wanted to comment. I saw something come to me from The Guardian. Headline says, Denmark lifts all COVID restrictions as vaccinations top 80%. That's the kind of headline I would want us to be able to have in the Jamaican context, because that, as we have said before, that is what is really going to get us out of the current situation that we are in.
Absolutely, and I'm fully with you on that. And I think all well-thinking Jamaicans are aligned, and we just need to help those who may not fully understand the issues to understand it better, and give them the benefit of the doubt that they will come on board once the information is provided. So thank you very much. Thanks again, guys, for coming. And let's continue the discussion and continue the action, follow-up action. Thank you.
COVID-19 is still here. Always wear your mask correctly while in public places, covering your nose and mouth at all times. Masks should never be worn over the head, under your chin, below your nose, or hanging from your ears. Recovery from COVID-19 can take up to 60 days or more. The mask or the ventilator? You choose. A message from the Ministry of Health and Wellness.